This is the pre-post design module on the cases where different patients are being measured over time. A design is called pre-post if data are collected at exactly 2 time points. Often, but not always, there's an intervention between the two. So the first time point is pre-intervention, and the second time point is post-intervention. We'll consider 2 cases. First, where data are collected on different patients at the 2 time points. And second, where data are collected on the same patients over time. One of the most common applications of measuring different patients over time is in practice improvement research. For example, suppose that the outcome variable is a measure of satisfaction with quality of follow-up care post-surgery. The pre-period represents the experience of patients under the previous system. The intervention might be a revised and hopefully improved system of follow-up care. Although a patient that has surgery in period 1 might conceivably also require surgery in period 2, in general it isn't even possible to measure the same patients during both time periods. The statistical analysis is simple. Use the version of the t-test that compares independent groups. The challenge is interpreting the results. The fundamental question in interpreting the results is whether you're comparing likes with likes. If so, the t-test is valid. If not, you should have a level of concern ranging from the trivial to the profound. Some of the things that can change include the following. Has the patient population changed over time? For examples, are surgeries being performed on more complex patients? Has the measure of surgical quality changed? This might be particularly likely if your data are derived from an administrative database. Between the pre- and post periods, has anything important changed other than the implementation of the new post-surgical follow-up protocol? This is critical because what you'd like to do is attribute differences between the groups to the impact of the new protocol. Can participants game the system? For example, do the clinicians know their information is being recorded in the second time period, but not the first? And finally, was the group being studied selected because of poor performance in the pre-period? This can lead to a phenomenon called regression towards the mean, which is described in another module. If none of these concerns seem major, then the t-test is probably sufficiently valid for most practical purposes. If the concerns do seem major, here are some of the design options. These options can be mixed and matched. The most natural way to deal with participants knowing they're being measured and artificially changing their behavior and response is to have a similar level of surveillance during both time periods. For example, if the data collection protocol implies that patients know they're being measured after the intervention is implemented, then you can apply the same data collection protocol before so. The strongest inference is provided by a control group. For example, if you expect regression to the mean in the intervention group, you'd expect a similar amount of regression in the controls. Of course, in practice, having a control group isn't always feasible, economical, or practical. But when you have the option of including a control group, it should be strongly considered. For purely observational designs, an elegant way to extend the basic pre-post paradigm is to follow numerous groups, intervening for some groups between times 1 and 2, intervening for other groups between times 2 and 3, and so forth. If the intervention works, you'll see an improvement in outcome directly afterwards. Moreover, you'll also be in a position to see how well the intervention effects are sustained over time.